What's the difference between a certification, a credential, an accreditation, or a certificate in a field of healthcare? And why is it that we even care whether or not a clinician has a certificate or certification or credential or accreditation? First of all, the reason why it is that we would care whether or not a clinician has one of these credentials is because it helps us assess whether or not that clinician is likely to be competent in a specialty area. So let me first start with licensure. Licensure is provided by a legal body that regulates the law of a certain jurisdiction. So say in the United States of America, all 50 states have the authority to prohibit people from providing a particular service or using a particular title if they decide to do so. And one of the legal justifications for that is to protect the public. So what the license does is it prevents, well, with a license, you can either have a practice act or a title act. So let's say a state establishes a license and to prevent people from either providing a service or using a title. If the license has a practice act, what it says is that no one is allowed to provide a particular service in that state without having authorization from the government. The government has a licensing board that regulates that license. So if someone wanted to provide a service in a state that has a license for a particular practice, they would have to have approval from that licensing board before they provide that service. A title act would say that individuals can't use a certain title. It's a protected title. They can't use that title unless they have approval from the licensing board in that state. So that's licensure. So the justification is to protect the public. It's supposed to set standards for the practice. And if people have complaints about the clinician, they could submit the complaints to the licensing board, and the licensing board can investigate. They could sanction the person's license, either suspend it or revoke it. They could administer fines and so forth. So that's licensure, which again has to do with a government prohibiting a particular service without authorization from the government. And then accreditation. Accreditation is provided by one organization to another. So there's different types of accreditation. And by the way, these terms are defined differently by different people. But accreditation, so like universities will get their degree programs accredited sometimes by a third-party organization. And again, what it does is it gives some assurance to the public, to people, that this program meets certain qualifications, it meets certain standards and requirements that are set by this other organization that does the accreditation. So an accrediting organization will decide what those standards are, what those requirements are in order to be accredited. In terms of telehealth, telemental health, sometimes an organization will get accredited for telehealth services by an accrediting organization. And again, the purpose of this is so people can assess whether or not this telehealth program is likely to be competent in providing telehealth services. So an accrediting organization, again, will set requirements, they'll set standards, and then they will actually review, they will audit another organization's telehealth program to see whether or not they meet those requirements. So to accredit a program in telehealth, an accrediting organization may want to review all of the policies and procedures of that organization for their telehealth program. They might want to do an on-site audit. They might want to do a simulated telehealth session with their clinicians. They might want to audit to make sure that all of their clinicians are, say, licensed and have professional liability insurance and so forth. So they'll set standards and requirements, and if the telehealth organization meets those requirements, the accrediting organization will say, you are accredited by us. And then there will be usually an annual review process to make sure that the telehealth organization is still meeting those standards. Now, a certification, there's two different types of a certification. Well, there's many types of a certification. One certification is a legal certification provided by a legal body, usually a state's legal body in the United States. So a state in the United States might say, in order to provide a service or use a title within our state, you have to receive a certification from our state. It's like licensure. And there will be requirements for that. They will define the certification, have a scope of practice, have requirements to be able to get the certification, an application process, a renewal process, and so forth. So it's very similar to licensure. Another form of certification is where a professional association will recognize that there is a specialty area. A lot of associations are actually created around specialty areas, right? So there's an association for play therapy, for EMDR, for trauma specialized care, for hypnosis, so different specialties will even create their own associations, which allows the professionals in that specialty area to collaborate with one another, help each other with professional development, to establish standards, to have continuing education for one another, and to maybe help regulate the profession to kind of keep a standard of care out there with that specialty area. So a professional association might provide a certification in that specialty area. And what they'll do is they will meet with those that are most knowledgeable in that specialty area, that have published in that area, that have done research in that area, and they will establish standards and requirements for that certification. Then they'll have a certification process. Now, usually the way, I guess the highest standard for certification is where a professional association will provide the certification. They'll have a board that establishes the requirements. They'll have a testing committee that will establish testing for that. The testing will usually be moderated or proctored. And this association themselves will not actually provide the training themselves so that there's checks and balances, but they will ensure that the training that is received is adequate to meet the standards. So basically they'll say you have to have a certain amount of training, you have to be licensed or certified by a legal body, you have to have a certain amount of supervision hours, you have to pass this certification exam, and you have to renew this certification on a periodical basis. You have to get CE hours on a periodical basis. So there's committees, they don't provide the training themselves, but they provide the testing and so forth. So that's one form of certification. And certification usually requires a renewal, okay? So some organizations themselves are not professional associations, but they will provide what they call a certification, which simply means that you completed their training program. That's about it, right? Which is very different than a certification, say, provided by a professional association that has proctored or monitored examination and so forth. All right. And then there is credentialing. And credentialing is a very broad term. It can mean a lot of different things. So organizations could provide a credential for a specialty area. And again, they set the standards and the requirements to get credentialed. And something about credentials is credentials usually require a periodic renewal for the credential, an application process, an application fee, and so forth. And then there is certificate programs. A certificate usually means that a professional has completed a particular training program. And the training program is usually a comprehensive program that covers all the competencies necessary for someone to be able to be competent in that specialty area. And then they'll get a certificate. All right, so why do we care about any of these things, right? Like I said, the purpose is to be able to assess whether or not a clinician is likely to be competent. So if someone is licensed, they have a graduate degree, they have supervision experience, they've been practicing for a long time, they have several certifications and credentials and so forth, does not mean that they're competent, okay? It means they might be competent, but it gives people the ability, it gives them one way to assess whether or not that person is likely to be competent. So whether or not it's a certificate, credential, certification, licensure, accreditation, what's important here is whether or not the clinician is competent. So how do you truly assess competency? Well, first, what you do in terms of setting the standards for any of these things is you investigate what are the competencies that are important for a clinician to really know in order to be competent in that specialty area, right? So in TeleMental health, our certificate program, right, in the creation of our certificate program, we have thoroughly investigated what are these essential competencies for a clinician to provide telemental health. Now, we don't cover every little aspect of telemental health. Telemental health is very broad. There's a lot of ways to provide psychotherapy and behavioral health services virtually, right? And it's always changing. Now, not every clinician is going to use mobile apps or secure texting or secure email or virtual reality or avatar programs or video conferencing or phone, right? Not every clinician is going to use all these different modalities. They're not necessarily going to work with groups and couples and children and older adults and people with severe psychiatric issues. So they don't necessarily need training on every little aspect of telemental health, but there are essential competencies that they do have to be aware of. So what we do is we investigate all the literature out there about telemental health, all the professional associations codes of ethics and the practice guidelines, the research that's available out there in terms of determining what are those essential competencies. So if you look at our certificate program, you can see they cover the essential competencies for someone to provide telemental health services. All right, so that's establishing it. Now, how do you determine whether or not someone is actually competent, right? If someone takes our online program, they are going to have to pass post-tests, okay, for each area. Now, if they take a live event, they're not passing post-tests. However, they are getting the interaction. So like for our clinical skills portion of our program, if it's done live, it's done through a live webinar usually, where they're actually practicing the skills and getting immediate feedback about their skills, right? Their environment, their setup, how it is that they utilize video in providing services. Now, another level of assessment for competency is to actually do an assessment for competency, right? Which is actually doing a simulated psychotherapy session where an organization will actually do a one-on-one with the clinician, and they can assess, well, they can review their policies and procedures for telemental health. They can do an audit of their location for the privacy and security and of their location, of their office, the setup of their office, their network, the technology that they're using, their workflow, their backup plans, all these kind of things. And then they can assess their competency in providing psychotherapy through, say, video, because the organization could have a short session, demo mock session with them and evaluate. Are they preparing the client appropriately? Do they have it? Are they establishing an emergency management plan? Do they have good video skills? Do they have backup plans? All of these things. And then they could have a grading process and then a learning plan for the clinician that's being assessed to go over and make improvements as needed before they get that accreditation, certification, credential, certificate, and so forth. So in our organization, we provide a telemental health training certificate. It verifies that a clinician has completed a comprehensive training program in telemental health. And then upon request, if organizations request an accreditation, certification, another level or form of verifying competency for the organization or for their clinicians, we do so. So we could have an assessment guide for the clinicians. We could review their policies and procedures. We could do on-site audits and so forth to verify these things. So what's important in terms of when you are evaluating a certification program, credentialing program, and so forth, is to look at what exactly is being required in order to receive that, okay? And then who's actually doing the training? Is the clinician actually being assessed for competency? And do the clinicians have the ability to reach out to a professional with questions that arise in the provision of services? So it's important. And how often are the trainings updated? Okay, that's another thing that's important. So it's important to look at what's actually involved in this accreditation, certification, credential, or certificate program. So that hopefully helps answer that. Now, some clinicians will ask, well, does my state accept this? All right. So does Louisiana accept this? Or does Georgia accept this? Or does New York accept this? And sometimes people ask that question because they're not really sure what question to ask. Okay. So whether or not a state accepts this is there's multiple questions there. One is, does the state is it within the scope of practice of a licensed professional within a particular state or jurisdiction to provide services remotely? And then if provided remotely, through which modality, okay? So if you're wondering if your state licensing board allows you to provide psychotherapy, say through video conferencing, that's a particular question. And you look at your licensure law for that, the rules and regs around the law. And we have a web page on our website, our resource page that covers that for all the different 50 states. The other thing is, does your state accept our certificate program or any certificate program and certification program? State licensing boards usually don't really concern themselves with that, right? They have their own process of providing licensure or a legal certification, right? So licensing boards typically simply require that you only practice within the boundaries of your competence, which usually requires training. Okay, so if you're going to provide telemental health services, you only ought to do that if you're actually competent to do so, which means you ought to have training in doing so. And the training really needs to be a comprehensive training program. So again, state licensing board, legislators, they usually don't get involved in certifications, credentials, accreditation, that kind of thing from other organizations. They have their licensure law that regulates, what's required of clinicians to be approved to practice in their state. Now, in terms of CE hours, continuing education hours, most licensing boards require that clinicians get a certain amount of continuing education every renewal period for their license to renew their license or their state certification. And then you have to look at what your state licensing board accepts as continuing education hours. Usually they'll accept CE hours that are approved or that are provided by a CE provider that's approved by a national professional association. So you have to look at the requirements of that. All right, so hopefully this helps kind of clarify these questions. If you have any questions, feel free to reach out to us and ask us, and we'd be glad to help you. Bye-bye for now.